We have three folks from the audience that we're going to ask questions, and I think we're starting with Brian Howard, who is our CEO from the great state of Arizona. Brian?
Senator Obama, thank you for being here today.
Thank you, Brian.
You know that rights and access and rights and ability have to go hand in hand. And we know that healthcare reform is an important part of your agenda. Mm-hmm. Could you talk and give us some specifics about how reproductive health care and women's health care is going to fit into and be a part of primary care for women in your health care reform plans, and how Planned Parenthood as a safety net provider will continue to be a part of the health care safety net for women and families across the country?
Well, look, in my mind, reproductive care is essential care. It is basic care. And so it is at the center and at the heart of the plan that I've proposed. Now, for those of you who are interested in the details, not plugging my website, but feel free to go to barackobama.com. But essentially, what we're doing is to say that we're going to set up a public plan that all persons and all women can access if they don't have health insurance. It'll be a plan that will provide all essential services, including reproductive services, as well as mental health services and disease management services, because part of our interest is to make sure that we're putting more money into preventive care. And so many of women's diseases are preventable if they're getting access to regular care. So we subsidize women who don't have health insurance or can't afford low group rates. We also will subsidize those who prefer to stay in the private insurance market, except the insurers are going to have to abide by the same rules in terms of providing comprehensive care, including reproductive care and mental care services, and they won't be able to keep people out as a consequence of pre-existing conditions. So that's going to be absolutely vital. Now, I know I'm limited on time, but I just want to expand on the second part of your question, which is the role that organizations like Planned Parenthood play. Obviously, my hope under a universal health care system is that everybody's got access to basic care and we have less of a patchwork quilt of services. That I still believe that it is important for organizations like Planned Parenthood to be part of that system, because many young women, for example, may be much more comfortable when they're in college or universities or other places going to Planned Parenthood clinics and services to get contraception, for example. So my hope is that we still have nonprofit participation under my plan. But in the meantime, what I've said is I believe we can have universal health care in this country by the end of the next president's first term, by the end of my first term as president of the United States of America.
And reproductive health includes access to abortion. And reproductive health includes access to abortion.